Hi everyone, it's Lauren Gates, and I am thrilled to be here on Facebook Live with Dr. Jennifer White. We are always so excited to feature our Spotlight Airway Dentist, and Dr. White is from Manton, Michigan. So, welcome, Dr. White. How are you today?
Thank you. I'm doing great. It's
Well, we're
Thursday, so
We're
doing
so
really good.
excited always to hear about your journey because it's certainly not mainstream and it's usually going upstream to help prevent, downstream disease. So it's not easy. And we always love to hear your journey, your perseverance, and kind of how you got to this place to now. You just told me before you were just on your local news media promoting this. So you're an advocate now for early craniofacial growth and development. So why don't you just tell us a little bit about who you are, where you're from, and your airway journey? Everyone's always curious to learn more about airway dentists.
Well, I have been a dentist. I'm coming up on 20 years already that I've been doing this, but I've only been in the airway realm in the last 5 years or so. But it really actually started probably way back when my sister had a pacifier for way too long, which completely disrupted her normal growth and development. She became a victim of extraction, retraction, orthodontics, open bite, you name it. Went through double jaw surgery, just the whole 9 yards. And so it's something that's very close to my heart to see that no child goes through what I had to watch my sister go through, for sure. But I started my journey helping adults with expansion with removable appliances, and I've saw some great things happen in there, but it's so much easier to start way earlier. I'm actually sitting by one of my favorite quotes, though you can't go back and change the beginning, but you can start where you are and change the ending by
Oh,
seeing
I love
things.
that. I love that.
So that's a good reminder. We're in my office right now that is really where we start. Thursdays, I actually have devoted to infant tongue and lip tie releases with our CO2 light scalpel laser, just because we know that stuff starts so early. I'm in northern Michigan, and there are not a lot of people around here that understand and know the what airway dentist means, and
Mhm.
just being aware of that and the concept of maybe having a child evaluated before the age of 12,
Right.
whereas we want to have them all ready set to go by 12 and just continue growing to have those wisdom teeth come in. So that's just a very foreign concept of where I am. So it is definitely, like you say, an upstream battle.
Right, right. Well, it's always nice to have a challenge, but
Yes.
let's talk about just the pediatric component because you said you started off with the adult expansion.
Mhm.
How long have you been treating children, and what prompted you to do that? Besides, was there a certain child? Was there? I know you told us your sister's story, but what was there another kind of trigger for you, or?
I think it's just seeing the adults having issues and seeing that if we can prevent them from getting to that point, it's just so much easier. And people are also more aware and more willing to help their kids. You just got to get the information out there to them. People just don't understand the fact that 80% of the jaw growth is done by, age 4 to, like little. So
Little,
why
little.
why are we waiting so long, when it's like 90% done by age 12? So it's really cool, especially with the what I've learned with the Airway Health Solutions and the different types of fixed expanders, and how much easier like the class 3 kids are to
Mm-hmm.
fix,
Mm-hmm.
4, 5,
Mm-hmm.
6. So
Do you have a case that stands out that you want to share with us? A story about a child and maybe even an adult. I don't know if you're able to help your sister in the long
yeah,
run.
no, I no, my sister, she already went through surgery, but I think she would probably
Okay.
be a surgical case again. But I would say when the number of kids that we've come in that have gone to an orthodontist and the orthodontist wanted to take out their premolars, and the parents just have this like they have that moment where they're like, I feel like that's not right, there's got to be another, something else that we can do.
Mm-hmm.
And so I can think of a few cases of kids like that that I have. One of them, I think he was 9 or 10 when we started with him. And when he first came in, his posture was off. He was very like to look down. He was very shy, wouldn't talk, it was like he could talk, but he was very, very shy, right?
Mhm.
And after treating him for a little over a year, to see now his canines and premolars coming in that mom was told would never come in without surgery and needed to be extracted. Um, and this kid now can stand up straight. So his alignment, his body posture is better, and he's happier. He's sleeping better. He actually had a diagnosis of sleep apnea. So it's combination sleep apnea and extractions and just, they why are we doing this? And so that mom drives over an hour to bring that boy to us, and
Mhm.
so now we're starting the little sisters sooner,
Mhm.
to make sure that they're on the right track. So I think we have the 7-year-old's fixed appliances ready to seat next week. So it's just really cool to be able to help the whole family, and then their 4-year-old, we're starting them with guiding appliances so that maybe we can avoid the whole, expansion altogether. So,
Right. That's so wonderful. And what advice would you give to doctors who are thinking about getting into airway or perhaps maybe intimidated by the space a little bit because it's still not conventional? I mean, they're still not teaching this in schools. What advice would you have for someone kind of on the fence about it?
uh, once you get into it, you can't unsee it. So just be aware that once you start, you won't be able to stop. But more importantly, you are going to change lives and help people so much. I love dentistry. I love what I do, but I've never changed a life with a DO on number 12. And so this is stuff that changes the trajectory of lives. And that is why I was just talking to my team about this. I was like, yeah, I'll probably be done with a drill in 10 years, but I'm not going to be able to stop this anytime soon. It's too important. Um, a few years ago, I said, it's just funny, you said they're not teaching this in school. A few years ago, I said, I think they will be teaching this in school. They just can't not, but it's
Mm,
going to take another 10 to 15 years.
right,
But
right.
I'm hoping that by the end of like my time, whenever I'm done, it will be standard of care. We're just ahead of the curve. And yeah, that
Hmm.
glass ceiling, hurts every day.
Yep, absolutely. And then speaking of that glass ceiling hurting every day, what advice do you have for perseverance and to just kind of going against the grain? Anything that you can share from a personal point of view?
I, I mean, honestly, it's just seeing those kids having their teeth come in straight. We just had a kid in yesterday that, they had their lower end teeth, they're all crowded, so they don't have the space. We put them in upper lower expanders, and in 3 months now those teeth are starting to line up straight.
Mm.
And now the kid is happier. They smile more, they feel better, they sleep better. I've only been doing this again for 3, 4 years, but I've never seen a kid not get better.
Uh, That's
Like,
powerful. That's
right?
powerful right there. Yeah.
So how do you
Mhm.
stop? I mean, honestly, it's the same thing when you do the tongue and lip tie releases on the babies. If you're doing it right and, selecting what you should do and doing what you do and the proper procedures and protocols, like they all get better. So how do you not want to help make it better? I mean, didn't we get into this to help people? So this is how you can really, really help people.
Right. And it's such a ripple effect. So like you were sharing, I'm sure you once you have one child that's getting it better, then the siblings come along. So do you feel like this was a practice builder for you as well?
Oh, absolutely. Absolutely, for sure. Like I said, Thursday we devote to the airway and tongue and lip tie releases, and the one was an 8-month-old, and they've been on the fence about taking care of the lip and tongue tie for 8 months.
Mm.
And then when I came in to check on her, I'm like, "How you doing?" She's literally crying tears of joy. She's like, "I didn't know it could not hurt." like to breastfeed my baby, and she's like,
Mhm.
I'm not waiting 8 months for the when the second one comes along. And so I think just getting seeing those people get better, the kids seeing as a parent, seeing your child thrive once you have expanded them and helped them with their nasal breathing and their habits. When you see that one get better, you are more likely to start them younger and tell everybody. Like, how do you not again?
Let's talk about some of the symptoms that you've seen get improve. ADHD, bedwetting. What is the most prevalent and most kind of um, awe-inspiring?
Yeah, well, again, it's really cool to see their personalities improve, just from going for so shy and anxiety,
Mm.
like just the anxiety and the compulsive, the ADHD, those kind of symptoms, just doing better in school, not getting sick as often. I there's a lot of them that the kids do so much better. One of my son's friends that we did some expansion on, they are a competitive swimmer. We did expansion. They had severe eczema, and after a year, their eczema went away, which also doesn't make sense, but it's somehow, it's a
Yeah.
symptom that got better. They sleep a lot better and they're performing better in their swimming and their sports. They can run faster, they can breathe better. So, um, again, when you see them improve in all facets of life, yes.
What is your reaction if people say this airway dentistry is a fad or this too shall pass with that? It's just another kind of, fad type of phenomenon. What do you think about that?
I just think they don't know. They don't know what it is. They don't understand the concept. I think probably the biggest thing I would say is that you have to set your ego aside. So all of us, dentists, medical professionals, we got to where we were going through school. We were getting good grades. We were always told we were the perfect, we were best, we were the greatest, blah, blah, blah. So you get, this ego that you're almost all knowing, right? And so when something comes along that challenges everything you've ever been told and the way you've been practicing, I mean, like you said, I've been doing this almost 20 years. I've been practicing this way or the traditional dentistry way for 15 years. So if you can't say, "Ooh, I haven't been doing the best for my patients for the last 15 years," that's a hard pill to swallow sometimes. But all I can say is, you know what? I didn't know better then, but I know better now and I can do better now. And so
That's
that
so
is
important, is
it.
that empathy actually for not knowing. If Dr. Michael DeLuke just had a wonderful conversation on our series about really giving some grace and having empathy,
Mhm.
because you don't know what you don't know, but now when you find out, it's really exciting. There's no turning back, as you said.
Right. Right. And that's the thing. Once you trip and fall into that rabbit hole, it's a long way down. There's a lot that goes into it. And I mean, I'm reminded there are people that I see regularly that before I knew better, they came in and they're like, "Oh, I want straight teeth." Okay, refer to the orthodontist. And they took out, their premolars as an adult. And I'm the one that took those premolars out because I was told to.
Right, right.
And so now when I see those people, I see their flat faces and I know they snore now. And I totally feel like that was my fault. But again, I didn't know better. But now I know better and that would not happen anymore. So to be able to get past that is a huge part of it for sure.
So glad you put the energy into kind of paying it forward. And we're so thrilled the work you're doing and just wanted to showcase and highlight. And you have a lot of education. We're all for taking all different platforms. It's
Hmm.
not just Airway Health Solutions, learn from everybody. So I
Yeah.
love your trajectory. And maybe you can speak to that a little bit as far as the education goes, right? It's not kind of a one and done.
Oh yeah, no. There's so many different ways to go about this, so many people, but I've learned something from every single person. I worked with Dr. Liao for with the AMD airway,
Yeah.
oh my gosh, airway mouth solutions. All of them are so close, right? Or holistic, he's holistic mouth solutions. I'm so sorry.
Okay. Okay.
And then actually I referred my niece and nephew who live down in Northwest Indiana, like they go to Dr. Boyd, like
Yeah.
you got to have this network. And it's when you see what your area needs, you really need to go for that. And so I think Airway Health Solutions is great for that pediatric that you guys have really given me the confidence to do fixed expansion and the guiding appliances in that pediatric population. But I'm just so excited to go to that next advanced course, which I've already signed up for and started because I need to be I have a lot of complicated cases that I need to do with some bracket and wire. Clear aligners can't do it alone, so very
I'm
excited.
glad you brought that up because I feel like some people think that it gets more complicated the more courses you take, but actually it makes it easier because there's more tools in your toolbox and the pieces to the puzzle. The picture gets clearer at the end
Exactly.
the more courses you take.
Yeah, and it's nicer too to meet your patients where they're at because maybe you have a mom that does not want fixed expansion. They want something removable. Well, I can do
Hmm.
that. If you
Hmm.
want fixed, I
Hmm.
can do that. Like the more
Right.
I can do to help. And then sometimes a treatment's the combination of the two. Maybe you start with the fixed expansion, then you move to guiding appliances. There's just so many more options. So the more tools you have in your tool belt, the more equipped you are to handle the most complex cases, which is what I'm planning on doing.
Oh, great. Well, when you're done with the advanced course, let's have you back and we'll talk about those
That'd
advanced
be
cases.
great.
Maybe we'll showcase some of those before and afters because we just love the work that you're doing. We're so proud that you're one of our alumni and thank you for sharing your time and your expertise.
Absolutely. Anytime.
Great. Actually, I'm going to say one more closing. You want to give a closing remark to just anything you just want to say to, I guess, to maybe to any dentist or student dentist of going this route. And just in a nutshell, I always love a wrap up of confidence.
If you're passionate about this, you won't regret it. You're going to change lives, and your career is going to be more fulfilling than it has ever been before.
Love
So,
it. Let's end it on that note. Thank you so much
okay.
for your time today and look forward to hearing more great things about you.
Thanks, Lauren.
Take care.